In this video, I'm going to show you how to fix morning lower back pain for good. Stay tuned. Hey everyone, Dr. Rowe coming to you from Spine Care in St. Joseph, Michigan. If you're dealing with a lot of lower back pain, stiffness, tightness in the morning and need a quick fix, this is a video that you're not going to want to miss. I'm going to go over easy, effective lower back stretching exercises that can give quick relief, even in as little as 30 seconds. As a bonus, these exercises can be done at home, in bed, in the middle of the night. They're really simple, easy, and again, very effective. So let's get started and get rid of that lower back pain right now. This lower back exercise is called the corkscrew, and it's a popular one with many because it can end in a satisfying pop, crack, or self-release into the lower back. I'm going to start off on my back in bed. This is going to be a two-part exercise. The first one being a beginner's, and then we're going to go over one that's a little bit more advanced. For the beginners, let's just bend our knees, keep our feet flat like this. Our arms are going to go straight up like this, just lock the fingers at the knuckles. What I'm going to do is I'm going to turn my head and my upper body in one direction as much as I can while my knees go in the opposite direction. This will cause that corkscrew effect into the lower back. Only go to the point where it's a comfortable stretch. And once we hit that point, let's hold this for 15 to 20 seconds. From there, come back up and take a breather. And then just simply repeat on the other side. Again, you might feel a pop or crack into the lower back with this one. It's completely normal. It's just gases being released from the joints. So you want to do this for 3 to 5 repetitions on both sides. For the more advanced one, let's go up to the edge of a bed. Whatever side is closest to the edge, let's straighten the leg out like this. The other leg is going to go at 90 degrees at the knee. Let's take the hand on the side closest to the edge of the bed and grab on the outside of the knee. So in this case, it's my left hand grabbing on the outside of my right knee. My right arm is going to go straight up towards the ceiling like this. I'm going to start off by just pulling my knee downwards towards the floor off the edge of the bed. And when you do this, it feels like a very, very good stretch. So the second part, we're going to incorporate that corkscrew. So I'm going to turn my upper body and my head in the opposite direction as I pull down with my knee. And this feels great. Hold this position for 15 to 20 seconds. From there, you're just going to relax, take a breather, and then repeat this up to 5 times. With each repetition, try to drive this knee down further and try to rotate your upper body even further in the opposite direction to get a better stretch. And when you're done on one side, always switch to the other to keep them both in balance. This exercise is known as a modified clamshell, and it's great because it's going to focus a little bit more into the hips across the pelvis. Whatever side that we're focusing on, let's have that side straight up towards the ceiling. So I'm pretty much laying on my left side, my right hip is going straight up. What I'm going to do is stabilize my upper body weight on my arm just like this. My right hand is going to go onto the hip right here just for a little bit more stability. First movement is very simple. We're going to keep the feet together. I'm going to raise my right knee and try to rotate it back. So I'm kind of lifting it up towards the ceiling and then going back with it. When you do this, you're going to feel the glute buttocks, lower back, hip and leg muscles really start to fire. So only go to your comfort level. Really challenge yourself to try to drive that knee back as far as you can. Once we hit that point, let's hold this for about 15 seconds. From there, you're slowly going to come back down, take a breather, and repeat this 3 to 5 times. With each repetition, challenge yourself to take that knee back even further to get a better stretch into the lower back and hips. This is how we can take it to the next level. Let's get back into that original position, but what I'm going to do with this one is lift the foot up like this, and this is going to cause a lot more rotation into the hips, so we're trying to drive that heel up towards the ceiling as much as we can, and this is a great stretch. So hold this for about 5 seconds, and then you're going to slowly bring the heel back down towards the other heel. Try to aim for about 3 to 5 seconds. And you're just going to repeat this right here for about 5 repetitions. Just go nice and slow with it. Really focus on trying to activate those muscles and get a lot more motion into the hip. And once you're done on one side, always switch to the other to keep them both in balance. So a big cause of lower back tightness, stiffness, or even pain in the morning is because of the SI joints or sacroiliac joints being tight and locked up. So here is a good 2-part process to help open them back up. We just lay flat in bed on our back like this. Let's take our knees, bend them at 90 degrees. The movement from here is going to be very easy. I'm going to do kind of a gliding motion like this, but I'm going to resist it with my hands. So let's take our left hand, place it on the outside of that left knee. Let's take our right hand, place it on the inside of the knee, and let's do that gliding motion, but I'm going to resist against it with my hands. And when you do this, you're really going to feel a lot of activation across the pelvis into those SI joints. Hold this for about 5 seconds comfortably, relax, and then repeat it on the other side. You want to do this for 5 repetitions on both sides. And again, you might get a pop or crack into those SI joints. That is completely normal. It's just gases being released from the synovial fluid. What we want to do next, and this is the second part, is take our hands, place them on the outside of our knees. Our knees are going to be bent roughly at 90 degrees. I'm going to drive my knees outwards but resist against it with my hands. This creates a nice isometric exercise into those SI joints. Let's hold this for 5 seconds. We're just going to relax, take a breather, and then repeat this 5 times. For the next part, we're going to take our hands, put them together, and then place them into our knees, and then squeeze in. And I don't know if you heard it over the microphone, but I got a very good pop into my SI joint. And you just squeeze inwards into your hands. And if this does cause irritation to your hands, you can just use a rolled up towel instead. But just squeeze in, hold for 5 seconds, relax, take a breather, and then repeat this for 5 times. With this lower back exercise, we're going to use traction or pulling motions to help open up the back and decompress the spine. That is, take pressure out of the spinal discs. Let's start off on our stomach and go right towards the edge of a bed. I'm just going to keep sliding slowly forward like this until my upper body comes off and I can go right on my elbows. What I'm going to do is just hold this position. I'm going to tuck my chin towards my chest and really allow my lower body weight to just be taken by gravity towards the floor. And this feels like a very good stretch. You should feel it pretty much from the lower back going all the way down. Hold this position for about 30 seconds, but you can hold it longer if you feel comfortable. 45 seconds all the way up towards a couple minutes. But if you need to take a breather, what you do is just push back with your hands and kind of pull back with your legs. But try to do about 5 repetitions of this and focus on just trying to let the lower back relax as much as you can and let gravity do all of the hard work. How we can take this one to the next level is, instead of going on our elbows, let's stretch our arms out in front of us as much as we can. Let's tuck the chin again towards the chest. Use our fingers right here to pull forward as much as you can, and this really will help intensify that stretch. Only go to your comfort level. I pretty much feel this one from my shoulder blades all the way down to my tailbone. But I just hold this one again for about 30 seconds, but again, you can hold it for as long as you feel comfortable. How you can take this one to even the next level is go towards one side with it. So I'm really bending towards my right. When you do this, you're going to feel the muscles in the lower back get activated just a little bit differently. So experiment. Go all the way towards the right, work your way over towards the left, and notice that if one certain angle, one certain spot hits it just a little bit better. And make note of that. Just throw some more repetitions in there. But you want to try to do this one for about 3 to 5 repetitions, challenging yourself to go forward just a little bit more. And when you're done, you just push yourself back up like this. Use your legs and your arms. So a big cause of lower back pain in the morning is because of muscle or soft tissue tightness, usually due to inactivity. Think we've been just in a position for hours while sleeping. Here is how we're going to tackle that with the $1 muscle fix. And I call it that because I'm going to be using a tennis ball, which is roughly $1. Let's start off in bed, and I'm going to take the tennis ball and just place it off to one side. With this one, you only want to go over the muscle around the spine. Don't put it directly over the spine. From there, let's focus on trying to take our lower back, or I should say our body weight, and driving it down into our lower back, into the ball, into the bed. And when you do this, it should really feel good over the spot that is achy or tight. What I want to do from there is just simple pelvic tilts. I put my hands off to my side and I'm going to rock my pelvis up and down. This will create a rolling motion over that tennis ball. Try to just do this for about 5 to 10 repetitions, and you can just switch it over different spots as needed to target different areas. But you just want to go pretty much across the lower back over any spot that you feel is very tight and achy. What you can also do from here is straighten one leg out, and I have the ball a little bit over to my left side. I'm going to grab that knee and just do a simple knee to the chest. When you do this, you're going to notice that this really activates over the area that you have a tennis ball. It becomes a lot more sensitive, so only go to your comfort level. You can hold this position right here for about 10 seconds and just relax and repeat as needed up to 5 times or until that muscle tightness goes away, and then from there you can just switch to different spots and repeat. You can also do more of a rotational component, so I'm going to do that knee to the chest, but I'm just going to take the knee over like this, and you'll notice that it activates the muscles just a little bit differently, so you'll be able to self-massage a little bit more over that area to hopefully get a lot of tightness out. But just put the ball over different spots in the lower back, go through some different motions, the pelvic tilts, knee to the chest, and then the rotational ones, and take what is most effective at getting rid of that lower back pain and tightness. If you liked the video and got a lot of relief, please show us your support by giving this video a like and maybe subscribing to our channel too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thank you for watching.